Development of the urinary system. So in this we describe development of the urinary system. Fetal kidney normally has a lobulated appearance due to the manner of development of ureteric bud in metanephric blastema. The lobular form diminishes at birth by means of progressive filling of the interlobular grooves. Although the adult kidney is smooth and regular, the prenatal appearance of sometimes persists, and we refer to the polylobed kidney or fetal-like kidney. Metanephros initially is located in the pelvic region but shifts later to the more cranial position in the abdomen. This so-called ascent of the kidney is probably due to the diminution of the body curvature as well as growth of the body in the lumbar and sacral regions. Kidney hilum usually faces ventrally, but ascent and rotation of 90 degrees or so turn the hilum so that it faces medially. Vascular supply in the pelvis. The metanephros receives its arterial supply from the pelvic branches of the aorta. During ascent to the abdomen, kidney is vascularized by arteries that originate from the aorta at continuously higher levels. The lower vessels usually degenerate except for the vascular variations and anomalies. Urogenital sinus and anorectal canal are formed during suppression of the endodermal cloaca by urorectal septum during weeks 4 to 7. Simultaneously, the distal portion of the two mesonephric ducts undergo complex development. Urogenital sinus, according to the position of the opening of the mesonephric ducts, can be divided into three distinct zones. Vesico-urethral canal or the urinary zone. Upper region above the entrance of the mesonephric duct is continuous with the allantois. Middle or pelvic zone and the caudal or phallic zone is the lower region and is below the entrance of the mesonephric ducts closed by urogenital membrane. Each mesonephric duct forms a diverticulum, the ureteric bud, near the end of week 5. The part of mesonephric ducts between ureteric buds and the posterior wall of urogenital sinus enlarges into ampulla or horns of urogenital sinus. The mesonephric ducts and the ureter open side by side to these ampullae. Selective development of the posterior wall of the urogenital sinus absorbs the two ampullae at about week 7, resulting in the ureterus opening separately and directly into the urogenital sinus just outside the mesonephric ducts. The posterior wall of the urogenital sinus continues to develop, and by week 8, the orifices of the ureterus have moved further cranially and laterally, while those of the mesonephric ducts have remained relatively fixed. Further remodeling of the urogenital sinus causes the ureterus to open into the urinary bladder, and the caudal ends of the mesonephric ducts, future ejaculated ducts, open into urethra in the male beneath the bladder. Caudal ends of the ducts in the female subsequently degenerate. The portion of the posterior urogenital sinus wall between the openings of the ureterus and the mesonephric ducts appear triangular in shape and becomes a future trigone of the bladder, that is trigonal vesicle of mesonephric origin. The mesodermal epithelium of the trigone derived from the mesonephric ducts is soon replaced by endodermal epithelium of the urogenital sinus. Urinary bladder. As the bladder forms, the allantois is progressively obliterated and forms urachus, a thick tube. It becomes the median umbilical ligament at birth. In the male, vesicourethral canal of the urogenital sinus gives rise to the bladder, and the upper portion of the prostatic urethra, that is proximal to the ejaculatory ducts, all are derived from endoderm. The lamina propria, smooth muscle serosa, develop from the adjacent splanchnic mesenchyme. Urethra, the mucosa of the cranial prostatic urethra, originally mesoderm, is replaced by endoderm. Lower portion of the prostatic urethra and the membranous urethra is derived from endoderm of the pelvic portion of the urogenital sinus. The epithelium of the penile urethra, except for the glandular part, comes from the cells of the phallic of the urogenital sinus. Epithelium of the glandular part of the penile urethra are terminal of the navicular fossa, develops by canalization of an ectodermal cord of cells that extends into the glans from its tip. The connective tissue and the smooth muscle develop from adjacent splanchnic mesenchyme. Prostate, at the end of 3 months of the epithelium of the cranial part of urethra proliferates, forms outbuddings that penetrate the surrounding mesenchyme. In the male, these buds form the prostate gland. In the female, the urethral and paraurethral glands. In the female, the endodermal vesicourethral canal of the urogenital sinus gives rise to bladder and the entire urethra. The connective tissue, smooth muscle come from adjacent splanchnic mesenchyme. Thank you.